Hey everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in healthcare. And our guest today is Dr. Meredith Warner. She is founder of Warner Orthopedics and Wellness. She's also author of the book Bone on Bone, an orthopedic surgeon's guide to avoiding surgery and healing pain naturally. Welcome, Meredith.
Well, thank you so much, John, for having me. I'm very excited to talk about this book and to talk to you.
Yeah, well, before we started, I told you this is very personal as someone who suffers from osteoarthritis in both knees. So I was excited to talk to you. But before we dive into the book and some of the details there, tell us a little bit about yourself.
Sure. I'm an orthopedic surgeon and I'm in Baton Rouge, Louisiana. And I also operate out of New Orleans where I teach for LSU Ortho. I'm a veteran. I was in the military and did some work with them, deployed twice. I'm originally from Delaware. I'm an Army brat, so we moved every 2 years. So I've kind of practiced medicine in a variety of settings, military, academic, private, so I've kind of seen it from all which ways. And over the years, I sort of developed a love and a fascination for all things natural and all, things like physical medicine, physical therapy, acupuncture, supplements, better diet, things like that. Because I found that my patients that engaged in that sort of world seemed to always do better than my patients that didn't. So I sort of taught myself everything I could because we are not taught any of that in medical school. And that started my love of treating things naturally to include osteoarthritis. And then from that, I developed the Well Theory, which is a line of supplements I have, and then wrote the book to sort of encapsulate everything because it just takes too long to tell people they're in a busy clinic.
It's true. I mean, I think we want the help. So I appreciate that. Talk to us about was the genesis, why you decided to write the book. Is it really to just give to your patients, bone on bone, or is it to reach a broader audience, and how did it come together?
Yeah, I think to reach a broader audience is probably more the truth. It came together over years. Like I said, I just read every paper I could get a hold of, went to conferences, learned everything I could, and then just sort of synthesize my protocol, which is outlined in the book. It's the MEDS protocol. We kind of made an acronym. Being a military person, I have to do that. So it's mindset, exercise, diet, sleep. And then under each of those, I break it down on how it's going to help you, the mechanisms, how it helps you, the science behind it, and how they all work together. But these are things I've been using in my practice for years and years and years. It's just, when you're in a clinic, you see 30 patients in a day or so, you really don't have time to get into people's diet, what's their sleep habit, this and that. It's hard to explain everything. So it's literally a guidebook. It's just an easier way to help people learn this stuff without having to do the years of research that I did to put it all together. And it lets me reach more people instead of just the people that happen to live in the Baton Rouge area,
Sure. Well, I thought it was interesting as I was reading it, the number of sources that you cite. Like this is a very well-sourced book that I thought was really interesting. And one of the sections that was probably most interesting for me, especially I think will be of interest to our Healthcare IT Today audience, was kind of this focus on surgery versus healing. Why is our health system so focused on just doing surgeries rather than kind of healing the patient?
Yeah, so I've thought a lot about this, and I think, and this is just my opinion, of course, I think it all comes from how medical schools began in this country. You may or may not know this, but back in the day, there was a very strong, tradition of being healthy, eating well, using plant-based medicine, and just sort of being healthy, like Ben Franklin's phrase, healthy, wealthy, wise, early to bed, early to rise. So there was that in this country, but then Rockefeller got together with Bayer when he was in power, at his peak, I guess, and developed what we now classically think of allopathic med schools, which is where I went. I'm a medical doctor, MD, so that's an allopathic medical school. And he partnered with Bayer to sell Bayer's products or pharmaceuticals, and they essentially created medical schools to create a sales force. So really, we are just a sales force for pharmaceutical companies, if you really get down to it, which is sort of sad. But I
Yeah,
think
that's kind of
that
cynical.
but what happened, I think, is that just started this whole school of treating disease rather than preventing disease and treating people and making people optimal. There's no concern about longevity. There's no concern about optimal health. It's just about what disease do you have and how can I treat it? Can I use a pill? Or if I can't use a pill, can I use a surgery? I think that's what happened.
I mean, talk to me about how you're able to avoid that, right? Because I mean, I get it. If I was an orthopedic surgeon, I'd be like, yeah, the knee pays a lot more than keeping you healthy, right? Like how do you? I mean, it sounds like how do you do that, right? How do you balance kind of this drive because you are a business, you need to make a living and provide, but you also want to do the best for your patients.
Yeah, this is it's a great question. I could probably be doing a lot better, I guess financially with surgeries, because believe me, there's probably 10 people a day I could indicate for surgery, technically speaking, but I don't believe in it. So I don't do as many surgeries as probably the average orthopedic could with what I see. I know I could qualify them under existing coverage determinations by insurance companies, but for instance, let's say you came in and you had a meniscal tear in your knee. I know based on all of the studies that have been coming out more and more recently, sham surgery studies, studies where they compare meniscectomy versus physical therapy over 5, 10 years or whatever. I know that the people that don't have a knee scope actually end up long-term doing better than people that do have a knee scope, even if they both have meniscal tears. And even if both knees hurt, it's irrelevant whether you have a scope or not. And in fact, it seems to make arthritis worse. So sometimes you just really have to check yourself and hold yourself back and remember that. And just really try to always treat people like they're your family members or you. And what would you do for you or your mom? It's kind of my rule of thumb. So I kind of don't indicate a lot of surgeries that probably other people would. But the other thing is I know all of this. There's a lot of surgeons that don't know all of this because they don't read what I read, because they're just stuck in the rut of what we're taught in residency and medical school, and they don't venture into these other worlds of nutrition and sleep and, diet and supplements and things like that. So you don't know what you don't know.
So give us a few examples of that. What does the research say about surgery versus other options? I know that book is chock full. Everyone needs to go buy it. It's on Amazon, your favorite bookstore, right? Bone on
Yeah,
Bone. But what are a few examples of that?
Yeah, so in Bone on Bone, I do talk about some examples. There's been some recent studies, even since the book was published. There's a research consortium called the Moon Group, MOON, and they look at shoulders
Okay.
specifically. And I may get the details slightly wrong, but they just came out with a 10-year follow-up study of people with partial rotator cuff tears, fixing it versus just doing therapy. And something like 70, 80% of people did fine just having PT. And of the rest, the 30% that ended up needing surgery, it was irrelevant if you got it month 1 or month 6. So everyone should try therapy for a very long time, even if the MRI says partial cuff tear, because odds are you're going to do great with just physical therapy and you never have to have surgery, which means you avoid anesthesia on the brain, you avoid all the risks of blood clot, you avoid the time off, you avoid the recovery, and you avoid the cost of surgery. So it's just a better way all around, I think. And that's just one recent study. In the book, I also talk about all the false positives of MRIs. If I have 30 patients at clinic and I did an MRI on everybody's knee, I mean, I could just draw you a picture of what their MRI is going to look like, because so many people have pathology on an MRI, whether they have pain or not. So like my age group, probably 50% of people have a meniscal tear, all comers, whether you hurt or not. So you can always find something on an MRI. It doesn't mean it's actually the source of pain, which comes back to what you were talking about. Why do we go to surgery and drugs? It's because in our world, most people still believe in what's called the biomedical way of looking at things, that there must be an anatomic reason that I can fix as to why you hurt. And that's just not the case half the time. Most times it's things like connective tissue disorders, insulin resistance, inflammation, oxidative stress, most systemic things that cause other diseases like atherosclerosis, diabetes, cancer. They're also damaging your joints, your muscles, your bones, and your ligaments. And we just don't think about that on a day-to-day basis.
Well, we don't pay him for that. I mean, sorry, was that kind of cynical? People know I'm simple on here, so that's fine. But I mean, what does it take to change that mindset? Can it be changed? Is it about the reading the studies and educating yourself, or what would you suggest to someone who is open to changing this mindset?
You talking about physician or patient?
Yeah, I'd say physicians, although I mean it's interesting. That's a really great point. Patients could force the physician to.
Yeah, I think the change is going to come from patients. I don't think the doctors are going to change anytime soon for a number of reasons. Right now, most people that graduate medical school get a hospital job, right? So they're working through a system and they have to follow the system's rules and the system's guidelines. Like if you come in with a knee scope, you have to hit a certain number, what are called RVUs or relative value units, which is the codes that Medicare breaks up our work into. And the hospitals track your RVUs. And if you're not producing enough RVUs, they cut your salary the next year. And they're very dogmatic about what they want you to do, when they want you to order MRIs, et cetera, et cetera. So if you're working for a system and you're no longer an autonomous physician, that's one reason that it's hard for doctors to change. The other reason is, again, just what we're taught in medical school and residency. But I'll tell you, there is a groundswell of people that want something different. I've seen it. I've noticed it. People love coming here because there are a ton of people in the community that do not want surgery and they don't want synthetic pharmaceuticals. They want to get healthy. They want to feel better. They want to play with their grandkids. They want to sleep well. They want to live a long, happy life, and they don't want to be dependent on the medical system. So I think the change will come, like most change in this country, it'll be a big push from the people.
Interesting. I mean, I literally had a friend of mine, ironically a doctor, although he's worked in IT mostly. He was ready to fly to Vegas to get an MRI because when in Maryland he was paying $2,000, it was $150 in Vegas for an MRI, and he was trying to avoid surgery. So he's like, "What other options do I have?" I'm going to be sending him your book, but that's a different side note. So, are there any other examples of healing that can be used to avoid surgery or make surgery better? Any other things that you see are and by the way, I think it was worth noting in your book, you do a great job of this. You're not anti-surgery. Like sometimes surgery is needed, but I'd love to hear any other examples where you're like, yeah, sometimes we're able to avoid surgery or even make surgery better.
Yeah, I think that's one of the problems in this country. Everybody is very tribal. It's all or nothing. If I'm on this team, I can't like anything about that team, which is ridiculous if you think about it. So yes, I great believer in a lot of what modern medicine has to offer. I operate all the time. A lot of my practice is centered around limb salvage and like preventing amputations for diabetics and things like that. But I don't ignore the other world. Now, there are some people where it's only diet, supplements, and you can never take a pill or never have surgery. And I don't live in that world either. I think that get the best of both worlds and optimize your life. That's my philosophy. Your second question, what are some more examples of natural healing? I think one of the biggest things that I've noticed that really makes a dramatic change in somebody is just if they start eating a little bit better. So something like 80% of our diet is ultra processed, meaning factory made foods that are 20 ingredients in a plastic bag made in a factory, and it's touched like 50 machines, which is essentially fake food. And that's 80% of the American diet. And so it's inducing inflammation on a constant basis and insulin resistance because of all of the added sugars and things. So if I can just get people to eat even half of their diet more natural, like real foods that you could actually find on a tree or in a field somewhere, cooking it at home with extra virgin olive oil, just doing that is half the battle, and people already start to feel better and notice a change after about a month or two. And then I often recommend basic supplements like D3, omega-3 fatty acids, tart cherry extract, which was one of my best-selling products because it's such a great natural painkiller. Turmeric is a great natural painkiller and also good for the gut and many other facets of life. So I think if you get the right micronutrients, or think of it like building blocks or bricks to build your house, you get the right micronutrients and a good diet, a lot of orthopedic problems get better on their own because the body then has the ability to heal itself. Half the time we don't have the right pieces and parts in us to even try to heal ourselves.
Wow. I think you're so right. And I think we're learning, right? I think the world is coming around to the challenge of our food and what's been done there. I think there's becoming more awareness around that. So that's super interesting. Well, you mentioned that you were a combat surgeon, you were in the military. I gotta take a minute. You like, it's amazing you were doing orthopedic surgeon performing combat surgery in Iraq, Afghanistan. One, thank you for your service. We're grateful for that. But could you maybe give us one example? What did that teach you? What was the lesson from being a combat surgeon in Iraq and Afghanistan?
Uh, yeah, I think the number one lesson is it's good to avoid war if at all humanly possible. There may be nothing more depressing than seeing an 18-year-old kid with multiple limbs blown off. Um, it's just really, really tragic. And then now to see how veterans are treated in this country relative to other groups, um, it's just really disheartening. I actually was at Bagram. That's where I operated out of Afghanistan. And we took care of not only soldiers, but in America, we take care of everybody. So I had to take care of enemy combatants. I took care of the native population. We were the only healthcare for anybody in that region really forever. So our clinic lines were very long and we took care of the local population. And I think that we Americans have a lot to offer and bring to the world. And I'm no fan of war. I guess I understand why it happens every now and then, but when you see up close what it actually physically does to people, you don't want any part of it. That's probably my biggest lesson.
Wow, gave me chills thinking about just the damage of it, right? And amazing people like yourself that are willing to go there, risk your own life in a lot of ways, and then help not just our own, military, but the others. I appreciate you for your service, and I love the service that you've created with this book. I think it's going to force another conversation. If for no one else, for me, and my orthopedic surgeon.
That you are getting the message, because I think it's an important message, one that I want to share. But like you said, and I say this in the book multiple times, even if you end up needing surgery, or your physician ultimately decides, you know what, this isn't working, you still have to have this procedure, the outcomes will be vastly improved if you follow the meds protocol in the book, because most surgical outcomes depend on all of the stuff I talk about: your diet, your sleep, your mindset, exercising, things like that. So it doesn't hurt to incorporate that to try to avoid surgery. But then even if you need surgery or medications, you will do better ultimately.
Yeah, that's a great message. I'm going to be thinking about this when I'm doing all my technology interviews and thinking, with the EHR vendor, why aren't you incorporating some of the,
It comes down to the payers.
conversation.
They do not pay for preventative care or health or wellness.
Yeah. But I think the accountable care organizations, value-based care, I mean, there's the potential maybe for some of them to start listening at. So
You can hope.
yeah, I hope so. Well, Meredith, I appreciate you taking time to talk with us and share about your book.
Thank
Everyone
you.
should go check it out. Bone on Bone, an orthopedic surgeon's guide to avoiding surgery and healing pain naturally. Something that many of us appreciate. So thanks so much. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting applications. Thanks.